Can everyone hear me? Perfect. Thank you for the lovely introduction. Today I am going to be talking about the prevalence and prevention of mental illness and suicide in Lebanon. And since there are a lot of similarities in the region, this might be applicable to your own home countries and settings. I come from the Embrace Fund at the American University of Beirut Medical Center, and we'll get to talk about the Embrace Fund at ABMC later on in the presentation. For an outline for today, I had to tweak things around, and we'll be starting with a relaxation activity. I'm pretty sure everyone at this point deserves one. What I'm going to ask you to do is close your eyes and go to your happy place. So, once you're ready, close your eyes and take a deep breath in. Hold it for about 5 seconds. And breathe out. Take a deep breath in. Let your lungs expand. And take a deep breath out. Now do this for a couple more times. And open your eyes when you're ready. All right, I have everyone back. We'll get to discuss a bit in our question and answer session about how it felt when you were doing that. But we're going to move on and talk about suicide, suicide worldwide, suicide in Lebanon. We're going to talk about the Embrace Fund at ABMC, and Embrace Fund's first national suicide prevention helpline, and we're going to talk about some warning signs for suicide and mental health illness, or dealing with an individual with mental illness in general. According to the World Health Organization, suicide is the act of deliberately killing oneself. So when one person decides to end their own life. Suicide is a tragedy that affects individuals, families, communities, and entire countries. And it has a long-lasting effect on the people left behind. It is estimated that for every completed suicide, there are about 15 to 20 individuals affected or bereaved by suicide. Yes, the individual ends their own life, but about 15 to 20 other people are affected. And their also risk of suicide increases throughout their lifespan. Suicide also occurs throughout the lifespan. We don't have specific ages where it occurs the most. It can happen to anybody, at any time, at any place. And it was the second leading cause of death among 15 to 29-year-olds globally in 2012, and this is a WHO statistic. Globally, over 800,000 people die by suicide, and that translates to one death every 40 seconds. So by the time I'm done with this presentation, about 15 individuals would have committed suicide. In 2012, 75% of global suicides occurred in low and middle income countries. Although it is a global phenomenon, but the majority of the numbers occur in low to middle income countries. And for every completed suicide, there's about 10 to 20 suicide attempts or failed suicide. And if we account for that, 1 to every 40 seconds, for the duration of this presentation, it would be about 150 to 300 individuals attempting suicide. What about suicide in Lebanon? Unpublished research from the Department of Psychiatry at ABMC indicates that one individual dies of suicide in Lebanon every 2.5 days. And these are the reported cases through the internal security forces. We got our statistics and data from the government. So those who are officially reported are one death every 2.5 days. And if we consider that for every one death we have about 10 to 20 suicide attempts, that translates to about one suicide attempt every 6 hours. In general, in terms of mental health statistics, we have about 1 in 4 individuals in Lebanon will suffer from a diagnosable mental illness during the course of their lifetime. And usually in the Western world, it is about 1 to 5 individuals, some places 1 to 4. We are comparable to other statistics in the Western world. However, in a recent 2016 study, we knew that about 6% of adolescents in that sample sought treatment for their mental illnesses. Also, although we see that mental health is prevalent, but seeking treatment for mental illness is does not happen very often, and 6% is a really low number. Previous research indicated 1 in 10 individuals sought treatment. That was up 10%, but this study's had 6%. So, in terms of numbers, you can see that there's a fluctuation. So in 2012, we had reported about 108 completed suicides. In 2013, we had about 111. In 2014, it rose to 145. In 2015, it dropped to 139. And in 2016, it was about 128. And you can see that males have a bigger number than females. It's usually because males have more aggressive methods of committing suicide, and usually their attempts are more successful. So in terms of completed suicide, the numbers of males are usually higher. Okay, for the statistics, we have numbers, but we can't really trust those numbers. And why so? Because the prevailing religious, legal, and social issues that surround mental illness and suicide in Arab countries prevent reporting of most of the cases to legal authorities. So when we contact the government or the internal security forces, the response that we get back is, well, maybe it's an accidental death or some kind of a natural death or unknown causes. And so because of a lot of religious and social taboos, a large number of these cases don't get reported. So the numbers that we have are a bare minimum of what is currently out there. This number also excludes the failed suicide attempts and those with current suicidal ideation. Okay. So let's go in to talk about suicide method. When we sort of dissect the numbers and see what are some of the methods used, we see that about 73.3% have used a violent method, which is either a gun or hanging or falling from a height. And only about 26.7% use a non-violent method like ingesting poison or overdose. And about 78% of males utilize violent methods versus 63.5% of females. And the top 3 methods of committed suicides are gunshots, 41.2%, hanging, 26.9%, and falling from a height, 13.1%. In terms of suicide location, we have about 47.4% of suicide in Lebanon being committed in Mount Lebanon, but this is only normal because Mount Lebanon is the biggest territory in Lebanon, and about 13.4% occur in Beirut, which is the capital. And you have 14% in Bekaa, and 13% in north, and 12% in the south. So, in Arab countries, most suicide research has been focused on suicide ideation. There's not been much research done about completed suicide or some of the reasons for suicide. There's one study in 2011 that found that 16% of 7th to 9th graders had seriously considered committing suicide in the year prior to the study. And in 2011, according to the WHO, 15% of 7th to 9th graders had seriously considered committing suicide, and 13.5% had actually attempted suicide. So these numbers are really shocking. 13% of school-age children had actually attempted suicide or were thinking of committing suicide. This is one of our awareness campaigns that we did. We embraced the Pigeon Rocks at Raushe to shed light on suicide awareness and prevention. So, Embrace. Embrace is an awareness support network for mental illness in Lebanon and the Middle East, and it is affiliated with the Department of Psychiatry at the American University of Beirut Medical Center. It was established in 2013 as a one-of-a-kind charitable and fundraising initiative for mental illness. Embrace launched the first national mental health awareness campaign, which was called Fikul Aqdi, and that focused on transmitting the message as mental illness is a medical illness. It is not a weakness of character, etc. And in 2014, Embrace launched the first suicide prevention campaign, Akid Rah Fi, which was the walk was called Into the Dawn, and it was at 5 a.m. It was a symbolic walk on the Rawshi. And we've held that commemoration walk since 2014. So, is everyone doing okay? All right. Embrace is currently working on launching the first national suicide prevention helpline in Lebanon and the region, because suicide prevention helplines have been effective in decreasing suicidality among callers. The National Suicide Prevention Helpline is envisioned to be a specialized telephone service that it will provide services such as suicide risk assessment, collaborative intervention in life-threatening emergencies, and referral to community resources and treatment programs. In the first year of operation, due to budget constraints, the helpline will operate from 12 noon and until 2 a.m. However, in future years, we expect to have a 24/7 operation. So what do we anticipate by having a suicide prevention helpline? We anticipate a decrease from 20 to 40% of suicidality and suicide rates in Lebanon. It will be in collaboration with the Lebanese Ministry of Public Health and the internal security forces to save individuals who are attempting suicide for high or imminent risk of suicide or attempt in progress. And the helpline is anticipated to pilot by April 2017 and launch in the summer of 2017. We are currently finalizing recruitment and training. We had our first training round right before I flew to Egypt. So I'm briefly going to mention the philosophy, mission, and vision of the helpline so that you have a better understanding of what it entails. So the philosophy of the suicide prevention helpline is the primary, secondary, and tertiary prevention of suicide and providing access to support during times of crisis. It is believed that those suffering from suicide should not be neglected nor abandoned, and it will serve as a support system, a source for referrals, and a collaborative interventionist for individuals in suicidal crises. And this is in line with the Article 567 of the Lebanese Penal Code to act to the best of your abilities to prevent suicide. Its mission is to ensure and respect the empowerment of individuals suffering from suicide, along with their ability to access appropriate care. It strives to increase awareness about suicide in Lebanon and the region, to support individuals suffering from suicide and those bereaved by suicide, and also creating a referral network of community resources. It strives to achieve all of this by engaging all stakeholders and in collaboration with the Lebanese Ministry of Public Health, and to create alliances and community leaders, etc. And all of this is done through fundraising efforts and collaboration. The vision, the helpline strives to be a center of excellence in suicide prevention in Lebanon and the region, and a hub for training and research in the realms of suicide awareness, assessment, and prevention. Conclusion, suicide is a growing concern in Lebanon. The numbers are increasing by the year. Helpline services are deemed to be crucial to a decreased suicide rate in the country, and further research is needed to better document the causes of suicide and suicidality in general in Lebanon and the region. Some warning signs for suicide for you to know, because the more aware you are, the more lives you may be able to save. So some of the warning signs include self-harm or reckless behavior, such as cutting or let's say, unprotected sexual activity, those kinds of reckless behavior. Withdrawal from loved ones or isolation, when individuals feel the need to stay in their rooms for long periods of time, not wanting to see other people or not spending more time with family. When individuals talk about killing themselves, when people say, this is not the life I want to live anymore, or I wish I was dead because I don't make a difference. Those things we might take lightly, but talking about killing themselves is one of the warning signs. and all talk about suicide must be taken seriously. Drug or alcohol abuse is one of the warning signs. Giving prized items away. If I start donating things I like, the books that I own, or my stamp collection, or I don't know, something that's meaningful to me, if I start giving it away, that is an indication or a warning sign. Loss of interest in activities that people usually enjoy doing. Hopelessness, depression, and anxiety. Those are all warning signs for suicide. I'm going to end with some tips about how to deal with someone with mental illness. And that is, a lot of people come to us and say, we're feeling down, we're depressed, or we're anxious, and we don't know what to do. And what would be your first reaction to that individual? Yeah, usually something like, it's okay, or better days will come, or, shut halak, things will get better. But usually the message we're communicating is, yeah, your feelings don't matter. It's fine, you should do better, or you should feel guilty for feeling this way. So what we have to do instead is listen empathetically and convey that understanding that what you're going through is tough, and I understand how tough it is, and maybe I don't understand how tough it is, and maybe communicating that. You lost a brother. I don't know how it feels like to lose a brother, and I can't imagine what you are feeling right now. Even the not understanding part helps them sort of feel that someone is there for them, instead of saying, okay, yeah, but you'll get over it soon. So validating the feelings. Yes, you're feeling down, and you have all the right to feel down because you went through X, Y, Z. Conveying that understanding that you're there, and lastly, providing support to these people so that they know there's someone there for them.